this is Selma Schimmel for the Group Room at the ESMO 2012 Congress happening now in Vienna. And we're joined by Anita Margulies, who is an oncology nurse with the European Oncology Nursing Society, also on the executive board. Hi, Anita.
Hi, Selma. Good morning.
What are the challenges that oncology nurses face in Europe?
The regulatory issues, the economic issues, the schooling issues, the cultural issues are affecting everyone throughout Europe as to what we can do, what we can accomplish. It's sort of swimming upstream, but we're all swimming. And it does affect the oncology nurses because of their position in the workforce, in the health workforce as well.
How do you sort through sort of the diversity, the cultural diversity that impacts the way people perceive their illness?
Let's take it from the EON standpoint. I think that's an easier input. What we're trying to do with our society, with EONs, is to give those nurses in those countries that are, let's say, less privileged, less informed, or less open, as much information, as many tools as possible that they can adapt their approach to their patients better, knowing more facts, different techniques, different methods of approaching persons who don't want to openly accept a disease. If you compare Vienna just now, on the Parliament building, there's this huge pink ribbon on the Parliament building and open discussions and everything. One can say that stigma here is much less than in other countries. And so it's a question of awareness, it's a question of public policy, it's a question if cancer is being talked about in the open, if the cancer societies are opening up to their public.
Is the oncology nurse training different by country?
Every country is different. According to the country's needs, I think things have been developed in a certain way or not. And some countries are definitely more advanced in their training, others are coming up, but everyone is interested in training their nurses to know more. And that's where EONS also comes in, is trying to support these countries with educational projects, with research projects, with information that they might need to develop a better nursing plan.
How far can an oncology nurse rise in their field here?
It depends on the country. There are some of the countries that are extremely well advanced in this, with the advanced nurse practitioner, with PhDs, with research, the whole gambit. There are others that have the programs but don't really recognize the level of competency. And so again, it's the challenge of 27 different countries with 27 different awarenesses of nursing.
Are nurses moving into the research arena here?
Very slowly, but they are, yes. And EONS has a research workshop each year to help those that are interested to support their propositions to learn how to do research better. So we're trying to cover all of the areas to help support the European nurses to get where they want to go.
We have a diverse viewing audience of European patients that are watching your interview. Is there a message you'd like to share with them?
If one would say, what is their relation to their nurse? I think that would be an important point to give the message to the patients, is that the nurse is with them from their diagnosis. They can use this person as a source of information, a wealth of information, and a different form of communication that they might have with their physician to get better information and to understand really what they might be able to do to help themselves, because this idea of the self-management is widespread internationally. And we know that most of our patients are at home, not in the hospitals, and so they have to be able to live, and the idea that they are living, want to live, is where the nurses can really support them in staying alive and enjoying their life as long as they can.
What you're saying is that the oncology nurse is the healthcare professional that sees the patient through every phase of their disease, no matter where their disease takes them. The oncology nurse is the constant in their lives.
I think what I would like to also tell the patients or whoever is listening, the EONS is not alone. We collaborate with many of the European societies that they are also involved in, especially ESMO, that's why I'm here. We have a newly formed collaboration to improve patient symptom management with the guideline development, where this is the first time that EONS has joined ESMO in a guideline development and publication for the benefit of the patients, which is really a highlight for the collaboration of the two societies. And we hope that continues also for the patient's benefit.
Thank you, Anita Margulies, oncology nurse affiliated with the European Oncology Nursing Society and on its executive board. I wish you great success in your efforts and your work.
Thank you, Selma. Thank you.